Hello and welcome back to another Minute in the Clouds with Greg. Thank you. I'm glad you're back. This is day 20. If you noticed or didn't notice, I missed yesterday again. I took another break. But we're talking about traumatic brain injuries. Excuse me. And today we're talking TBI complications and long-term impacts, part two. So we've been discussing, as I said, traumatic brain injuries, but the secondary impact and long-term complications are often overlooked, despite the significance that they play and have on somebody. And people usually think that they've recovered after the initial trauma, and they don't take into consideration the long-term effects. So if you're new to the channel, I'm glad you're here. Consider subscribing, hit the bell to be notified when I post new content. Leave a comment, let me know what kind of content you'd like to see, and I'll try and cover that. So some more on complications and secondary effects of a brain injury. Chronic headaches is one of the common complications after a traumatic brain injury. Chronic headaches can significantly impact someone's quality of life, and they might require ongoing medical management. Here's an overview of the connection between secondary TBI complications and chronic headaches. And there's different kinds of headaches that can be associated. You've got your post-traumatic headache, or PTH. These are headaches that specifically occur after the traumatic brain injury, and they're often considered a subtype or attention type of a migraine headache. And they can vary in intensity, frequency, and location. And they might be accompanied by other symptoms such as sensitivity to light, sound, nausea, cognitive difficulties. And some of the causes for that: neurochemical changes following a TBI. There can be a disruption in the brain's chemistry and neurotransmitter levels, which can trigger these headaches. Altered blood flow, changes in blood flow pattern to the brain and the surrounding areas can lead to headaches. You've got muscle tension and neck stiffness, is commonly experienced after a TBI, and that can contribute to the tension type headaches. Then the sensory sensitivity, increased sensitivity to light, sound, or other stimuli can trigger migraine-like headaches, and I get those. Nerve damage damage to nerves or brain structures can lead to chronic headaches. Medication overuse can lead to headaches as well. Because of excessive use of certain pain relievers or sudden caffeine withdrawal, it's possible to experience more than one type of headache worsening of pre TBI headaches. If you had them, they could get worse afterwards. Most headaches aren't dangerous, but seeking medical attention is recommended if headaches will get worse or they're accompanied by other symptoms. And the risk factors, depending on how severe the TBI is, the initial brain injury can influence the likelihood of chronic headaches. Previous history of headaches, if you've had a history of migraines or tension type headaches before your TBI, you'd be at a greater risk of developing that. Gender and age can play a factor. Females and older adults are more prone to post-traumatic headaches, and genetics. Genetic factors might play a role to the susceptibility of chronic headaches also. Diagnosis usually relies on history and symptoms. Special tests are very rarely needed or relied upon to diagnose that. Treatment and management, the approaches to treatment can vary. Might include lifestyle changes, medication changes, therapies aimed at managing, preventing headaches. And some of those things would include, as I said, medications, pain relievers or anti-inflammatory drugs, triptans for migraines, and preventative medications can sometimes be prescribed. Lifestyle modifications, getting adequate sleep, stress management, regular exercise, and a balanced diet can help manage headaches. Physical therapy can sometimes help because of the relaxation exercises and stretches that can relieve muscle tension, might reduce the headache frequency. Cognitive behavioral therapy, CBT, can help manage pain and improve coping mechanisms. Trying to avoid triggering factors, identifying what triggers might be, or what triggers might make your headaches worse, such as sometimes people are triggered by certain foods, drinks, or activities. Biofeedback, which is learning to control physiological functions using biofeedback techniques, can be effective in headache management. And neuromodulation, in some cases, neurostimulation techniques might be used to alleviate chronic headache symptoms. As I said, every individual is the same. Some is different. Some facts on that: over 30% of people with a moderate to severe TBI experience long-term headaches after the injury, and those headaches can persist beyond a year, and they can hinder daily activities and cognitive abilities. Headaches can be caused by surgery, blood flow collections, changes in brain, neck, skull injuries, stress, medication side effects. Migraine headaches involves hypertensive brain areas triggering pain and often present with nausea, vomiting, light and sound sensitivity, and auras. Tension type headaches are likely linked to muscle tension, with squeezing sensations around the head. And then there's other headaches that you can get that kind of result from neck and soft tissue injuries, often start in the neck and the back of the head. Lifestyle changes like sleep improvement, exercise, avoiding triggers, that kind of thing can help. Sometimes antidepressants and other therapies, physical therapy, nerve stimulators, and more. Anti-seizure sometimes are needed, beta blockers, Botox injections, lots of different things that your care team can do, but it's important to seek medical advice. Comprehensive individualized care, because of the complex nature of a secondary TBI or a secondary TBI complication. Care afterwards should be very comprehensive and individualized in the approach that it takes towards the individual, with a multidisciplinary approach, with everyone on board, including the neurologists, neuropsychologists, rehabilitation specialists, mental health providers who work collaboratively on treatment care. Ongoing monitoring and follow-up and evaluations are crucial just to stay on top of that. Another common problem is sleep disturbances. With things like insomnia, people with TBI might have difficulty falling asleep and staying asleep, or experiencing non-restorative sleep. And insomnia can exacerbate, make things worse for other TBI symptoms and hinder healing. I have a lot of problems with insomnia. Hyperinsomnia, on the contrary, some people might experience excessive daytime sleepiness and difficulty staying awake during the day, and that can interfere with cognitive function and daily activities. Sleep-wake cycle disruption, TBI, can affect the body's internal clock, the circadian rhythm, leading to irregular sleep-wake patterns, and that disruption can contribute to sleep difficulties or daytime fatigue. Some people will get nightmares or sleep terrors. TBI-related changes in brain function can lead to vivid nightmares or sleep terrors, causing further sleep disruption and emotional distress. And we thought my nightmares were PTSD, but I'm thinking now it could be brain injury related. Sleep apnea, TBI may increase the risk of sleep apnea, a condition where the breathing temporarily stops during sleep, and sleep apnea can contribute to poor sleep quality and excessive daytime sleepiness. And I have sleep apnea, but I had that before, and maybe I'll do a talk on that sometime. It can contribute to restless leg syndrome. Some people with TBI might develop restless leg syndrome. The characteristics of that is irresistible urge to move the legs, and it's often accompanied by uncontrollable sensations, and that can interfere with falling asleep and staying asleep. And of course, the circadian rhythm can get out of, be dysregulated. I mentioned that. narcolepsy, although rare, TBI can trigger narcolepsy, a neurological disorder characterized by sudden episodes of uncontrollable sleepiness, and in some cases, muscle weakness, or triggered by strong emotions. People just fall asleep in the middle. It's a rare side effect, but it could be one. Pain and discomfort, physical pain resulting from the initial brain injury or associated injuries can make it challenging to find a comfortable sleep position, and that can make you sleep bad. Anxiety and depression, a TBI can increase the risk of developing anxiety and depression, both of which can contribute to disturbances in sleep, and sleep difficulties in turn make everything else worse, and the depression and anxiety worse. To address the sleep disturbances, overall recovery, proper management might involve a combination of different things: medical, behavioral interventions. Some of the medical interventions, depending on the specific sleep issues, may include medications. Meditation wouldn't be bad. Medications to improve sleep quality or treat sleep disorders like sleep apnea, or manage anxiety and depression. Behavioral interventions, your CBT, can be effective in treating sleep disturbances by addressing any negative thought patterns, and maybe promoting healthier sleep habits. Sleep hygiene, that's a thing, encouraging good sleep hygiene practices, such as maintaining a consistent sleep schedule, going to bed at the same time each night, getting up on the same time each morning, creating a comfortable environment for you, avoiding stimulants close to bedtime. They say the bedroom should be for intercourse or sleep only. Shouldn't really have a TV in your room. Physical therapy can sometimes help with physical discomfort. Working with a physical therapist can help alleviate pain and improve mobility, making sleep a bit more comfortable. Counselling and support, addressing emotional issues through counselling and support groups. Support groups can be very important. I belong to a couple of brain injury support groups, which really do help. They can help with TBI symptoms and with anxiety and depression and other emotional factors, falling asleep. Managing to sleep disturbances is a secondary complication, and again, a comprehensive approach is important. Other memory problems, TBIs can result in cognitive changes, memory issues, and other symptoms, and the risk of cognitive decline and dementia might increase with repeated traumatic brain injuries or severe injuries. There's ongoing research aimed to try and find the connection between TBIs and dementia. Cognition refers to the process of knowledge and thought, and traumatic brain injury can cause various cognitive challenges affecting attention, memory, information processing, communication, judgment, and problem-solving skills. And TBI impacts thinking abilities, including attention, memory, planning, communication, and judgment. Cognition facts, attention. TBI can lead to attention difficulties, distractions, trouble switching tasks. Some strategies to improve that include reducing distractions, focusing on one task at a time, taking breaks, processing information. Processing information becomes slower after a TBI, which can cause trouble understanding spoken or written content. Some tips for that might include minimizing distractions, taking notes, asking for clarifications, maybe voice notes. Cognitive communication, TBI affects the expressing of thoughts and understanding others in communication. Practicing one-on-one or in small groups can help improve communication skills. Learning and remembering, TBI can hinder learning and memory, leading to difficulty remembering new information. I really struggle with that. Techniques like using memory aids, associating new information with certain things, or getting adequate rest can help. Planning and organization. Traumatic brain injury can make planning and organizing tasks very challenging. I have trouble with that, and with the TBI and the ADHD as well, and depression, PTSD. There's a whole bunch of different factors going on. But some strategies can use include using calendars, breaking tasks into smaller steps, and organizing belongings systematically, putting systems in place. Judgment and problem solving. Traumatic brain injury excuse me, affects decision making and problem solving abilities. Involving other people in problem solving, using step-by-step strategies, seeking advice, trying to improve your skills, stuff like that would be helpful. Cognitive evaluation and rehabilitation. Neuropsychologists assess cognitive changes after a brain injury, which can guide treatment plans, and cognitive rehabilitation and therapy with specialists can help with the cognitive aspect. And then consultant professionals seek medical advice, for any challenges. Some good recommended reading I'll put on the article I post later today. Memory and traumatic brain injury, emotional problems, sleep and traumatic brain injury, social skills. And I'll put some links on the article that I post on the website. Alzheimer's disease or another form of dementia. Certain types of traumatic brain injury might be linked to an increased risk of developing Alzheimer's or another form of dementia years later. Someone might show more severe changes in thinking skills, which are key characteristics of dementia, even after appearing to have recovered from the initial effects of the injury. However, there is no evidence that a single or a mild traumatic brain injury alone could increase the risk of cognitive decline and dementia. Currently, there's no known strategy to reduce the long-term risk of cognitive decline and dementia after experiencing a moderate or a severe traumatic brain injury or repeated mild traumatic brain injuries. It's important to note that not everyone who experiences head injury in those categories will develop dementia. A study published in Neuroscience in 2021 found similarities in brain changes between individuals with mild TBI and Alzheimer's disease, including a reduction in cortical thickness compared to healthy individuals. Ongoing research aims to understand the underlying mechanisms connecting TBI to cognitive decline and dementia in the brain, including potential factors that make that worse. Secondary TBI complications and difficulties with concentration. Secondary TBI complications can range from cognitive, emotional, and physical challenges. Difficulties with concentration are among the cognitive impairment commonly associated with primary and secondary TBIs. An overview: cognitive impairment. Secondary TBI complications can cause a variety of cognitive impairments, including difficulties with attention, memory, executive function. Executive functions refer to higher level cognitive processes that help planning, organizing, problem solving, maintaining attention. When those functions are impaired due to a secondary TBI, people might struggle to sustain the focus and concentrate on tasks. And there's neurochemical changes. Secondary TBI can lead to neurochemical imbalances in the brain, affecting transmission of neurotransmitters that play a role in attention and concentration, such as dopamine and norepinephrine. These imbalances can disrupt the brain's ability to regulate attention and make it harder for people to concentrate on tasks. Fatigue and energy expenditure. Secondary TBI complications often include increased fatigue and reduced energy levels, not having any energy. Fatigue can significantly impact somebody's ability to concentrate, as it requires effort to stay focused on tasks when dealing with to tiredness and fatigue. Some people might also find it challenging to sustain the attention for extended periods. Sensory overload, I experienced that after a traumatic brain injury. Some people might become more sensitive to stimulus such as noise or light in crowded environments. This sensory overload can be very overwhelming and make it difficult to concentrate as the brain struggles to filter out irrelevant stimuli. Emotional distress, disturbances such as anxiety, depression, mood swings can be common after a TBI. These emotional challenges can interfere with concentration, as emotional distress demands significant amount of cognitive resources, leaving fewer behind for focusing your attention. Disruption in the neural networks. Secondary traumatic brain injury complications can disrupt the connectivity of neural networks in the brain. And these networks are essential for efficient information processing, including concentration. Disruptions in those networks can make it difficult for brain regions to communicate effectively, and that can impact concentration and other cognitive functions. Medication side effects. Medications commonly prescribed to manage secondary TBI, such as pain meds or those targeting mood disorders, can have side effects which can impact concentration. Sedation, drowsiness, cognitive slowing are potential side effects which can hinder your ability to concentrate. We mentioned sleep disturbances for people with secondary TBI. Sleep disturbances such as insomnia or disrupted sleep patterns. Poor sleep can definitely affect your concentration as it impairs cognitive function and reduces your overall alertness and attention. Addressing difficulties with concentration after a TBI often involves a comprehensive approach that might include cognitive behavioral therapy, managing fatigue through energy conservation strategies, utilizing assistive technologies to aid concentration and organization. I use my Alexa a lot. Developing coping strategies for sensory overload, managing emotional distress through counseling or therapy, adjusting medication regimes to minimize cognitive side effects, obviously under medical supervision, implementing sleep hygiene practices to improve sleep quality. Secondary traumatic brain injury complications and mood swings. Secondary TBI can lead to mood swings for some people as part of a broader range of emotional and psychological changes. Secondary complications of a brain injury, traumatic brain injury, can arise from various factors, including the initial injury itself, subsequent medical treatments, and the brain's ongoing response to the injury as well. Mood swings are a common manifestation of these complications, and here's how they might be connected. Now, here's how they can be connected. Neurochemical changes. TBI can disrupt the balance of neurotransmitters, as we've mentioned, in the brain, which are essential for regulating mood and emotions. And that disruption can result in mood swings, including periods of being irritable, feeling sad, anxiety, and even sudden shifts between those different emotional states. Cognitive challenges. Traumatic brain injury can lead to cognitive impairment, such as difficulties with memory. I have a lot of that. Attention and executive functions. These cognitive challenges can be frustrating, and I know I certainly get very frustrated, and they can lead to feelings of helplessness, and mood swings as people struggle to perform tasks that, once upon a time were very easy, are no longer easy to do at all, anything but. Emotional regulation. TBI can impair the brain's ability to regulate emotions effectively, and that can lead to heightened emotional responses, decreased emotional resilience, and difficulty controlling mood swings for some people. Pain and discomfort. Many individuals with a TBI experience chronic pain, headaches, and other physical discomforts. And those physical sensations can also contribute to mood swings, as persistent discomfort can make things worse, including emotional distress. Social and lifestyle changes. Traumatic brain injury can result in changes to somebody's social and work life and their daily routine. Those changes can lead to feelings of isolation, loss of identity or purpose, decreased self-esteem, and all of those things can contribute to mood swings if somebody's having mood swings. Depression and anxiety. Traumatic brain injury survivors have an increased risk for developing depression and anxiety, with periods of heightened anxiety and panic. Medication side effects. Medications used to manage traumatic brain injury symptoms can have side effects that impact mood. For example, certain pain medications, sleep aids, or drugs that target specific TBI related symptoms might influence emotional states and contribute towards mood swings. Brain healing and plasticity. As the brain heals and adapts to the injury, there might be periods of progress and then setbacks, and those fluctuations in the brain's healing process can lead to corresponding mood swings. So it's important to note that mood swings are just one potential emotional consequence of a secondary TBI or a complication. Other emotional changes can include depression, anxiety, anger, emotional ability, uncontrollable laughter, uncontrollable crying, changes in social behavior. And the severity and duration of those emotional changes can vary wildly from one person to the next, and can be influenced by factors such as how severe the initial injury was, the effectiveness of any medical treatment, and the effectiveness of any rehabilitation, and also your support system that you have around you as well. If you know someone that's experiencing mood swings or emotional challenges after a brain injury, it's very important to seek medical and psychological help. A multidisciplinary approach, it includes neurologists, neuropsychologists, psychiatrists, therapists, and speech pathologists, just to mention a few. And then anxiety, we've talked about anxiety. Secondary TBI complications can have a significant effect on the cognitive aspects and well-being. Anxiety, one of the emotional and psychological complications. And here's how an overview of the secondary TBI complications as they relate to anxiety, in relationship to anxiety. Inflammation and swelling. The initial injury of the brain can experience inflammation and swelling, which can lead to increased pressure within the skull, and that further damages brain tissue and potentially makes cognitive and physical deficits caused by the primary injury. Intracranial pressure changes. If there's an elevation in the intracranial pressure, that can develop as a result of swelling or bleeding in the brain. And high intracranial pressure can compromise blood flow and oxygen delivery, and overall brain function. Cerebral blood flow dysregulation can disrupt the brain's ability to regulate the flow of blood, leading to not enough oxygen and nutrients reaching the brain cells, and that can contribute to cognitive deficits and other complications. Seizures. Traumatic brain injury increases the risk of seizures. These abnormal electrical activities in the brain, they can further damage brain tissue and contribute to cognitive and emotional difficulties. There's also the accumulation of cerebral fluid in the brain is another factor which can contribute to after a traumatic brain injury, and can lead to increased pressure within the skull. You could get headaches, cognitive impairment, and then with your anxiety, physical changes. The brain injury itself can disrupt the brain's functioning, leading to changes in mood, cognitive challenges, emotional processing of emotions, uncertainty and loss. TBI often results in significant changes and uncertainty about the future. And that uncertainty about the future, coupled with a potential loss of independence and role changes, can really contribute to feelings of anxiety and distress. Pain and discomfort, the physical pain resulting from the brain injury or a related medical procedure, can contribute towards anxiety. Chronic pain can also impact the mood and overall well-being. And then there's a social and emotional isolation. TBI can lead to difficulties in social interactions and relationships. Feelings of isolation, a sense of not being understood by others, can contribute to anxiety. It's important to note that anxiety can manifest itself differently in different people. It can range from mild to severe. So if you know someone or you yourself is experiencing problems with that, talk to somebody. And then depression, secondary TBI, and complications associated with that can lead to depression or worsening in depression. Some of the reasons why that could be swelling and intracranial pressure. Brain swelling can result again from the initial injury or subsequent inflammation. Increased intracranial pressure can lead to further damage and impact brain function. Infections, traumatic brain injury can weaken the immune system response, making people more susceptible to infections, particularly if invasive medical procedures are required. The seizure risk we just mentioned, brain damage can, tissue damage can lead to neurological complications. Hematoma and hemorrhage, secondary bleeding within the brain can occur, leading to additional brain damage and complications. Cognitive and functional impairment, secondary complications can make the cognitive deficits and problems worse. I'm sorry, I'm struggling today for some reason to read. And so the depression, neurochemical changes, the disruption in neurotransmitter balances can lead to depression. Physical and functional changes in the brain can lead to physical disabilities and cognitive impairments and changes in daily functioning. Lots of different factors that can make depression worse. Social isolation, not being able to do stuff socially that you would have done before. And it can be an adjustment, psychological adjustment. Each person is affected differently than somebody else. And then there can be personality changes as well. Secondary TBI can certainly cause personality changes. And some factors that can contribute to that: emotional instability. Traumatic brain injury can lead to emotional disturbances. We've mentioned mood swings, irritability, anxiety, depression, and some people might struggle to control their emotions. Heightened emotional responses to situations might be a problem. Aggression and irritability. Some people might become more impulsive or prone to outbursts of anger, or sometimes even aggressive. This can strain relationships and make social interactions very challenging. Apathy and indifference. TBI can lead to a lack of motivation, lack of interest, lack of enthusiasm for activities that were previously something that you might have enjoyed. People might appear to be emotionally flat or just indifferent to the surroundings, whatever. Impulsivity, impulsive behavior can often be seen acting without thinking about the consequences, and that can increase after a TBI. Some people have social inappropriateness. TBI related changes might lead to some people displaying socially inappropriate behavior, such as making inappropriate comments or actions without recognizing the impact on other people. There can be a lack of self-awareness. Some people with a brain injury might have difficulty recognizing or acknowledging their own personality changes, and the lack of insight can complicate the rehabilitation efforts and further strain relationships. There can be a decreased empathy. The brain injury can affect someone's ability to understand and share the feelings of others, and this reduced empathy can affect relationships and interactions with loved ones. Personality shifts. Sometimes people with a TBI, the personality can shift and result in a complete change in personality traits, turning an introverted person into an extroverted person, or the opposite way around, or causing a previously calm person to be more aggressive. And some of the influencing factors that can affect personality changes, the location and the severity of the injury, the part of the brain that's injured, and the extent of the damage can influence the specific personality changes that might be experienced. And again, these are just some things that can happen, not are going to, or not everyone's going to experience this. Another factor could be any pre-existing traits. Some people with certain pre-existing personality traits might be more susceptible to specific changes after a TBI. Support systems, the availability of support systems. One moment. The availability of support systems from family, friends, healthcare professionals, those things can all impact how well a person will do after brain injury, and can affect how they cope with personality changes. And rehabilitation and treatment, engaging in appropriate rehabilitation and therapy can help manage personality changes and improve overall functioning. Consulting with a therapist is good. Cognitive behavioral therapy, psychotherapy, family counseling, those things can all help people and their loved ones to try and understand and manage these changes. Depending on specific symptoms, medication might be prescribed to help manage mood swings and unstable emotions. Support groups, taking part in support groups can provide support to people and their family members, and give a sense of community, a sense of shared experiences and learning, education about the different changes that might take place after a TBI. That can all help out as well. Some additional concerns as we come to close to an end here is post-concussion syndrome. Post-concussion syndrome is a condition that occurs as a result of TBI, and that's characterized by symptoms that might be persistent for weeks, months, or even years after the initial injury. Can include headaches, dizziness, fatigue, difficulty concentrating, pretty much the stuff that we've mentioned, memory problems, irritability, sleep disturbances, changes in behavior, post-traumatic epilepsy. Seizures can occur following a TBI. These are known as post-traumatic epilepsy seizures, and they can be unpredictable. They might require ongoing medical management, and it's very important for people who've experienced TBI to be aware of the potential risks of these complications and seek appropriate medical care and support if you're experiencing some of these things. And then there's another secondary side effect and complication, chronic traumatic encephalopathy, and I'm sorry, CTE, I can't pronounce it. I'm sorry, CTE. You have to look that up. And that's a progressive degenerative brain disease, which is typically found in people who've experienced repetitive brain trauma, commonly seen in athletes who participate in high-impact sports or contact sports. And it's a condition that gradually worsens over time, and it can lead to a lot of different cognitive, emotional, and physical symptoms. It's important to be aware of those long-term complications. Motor disorders, in addition to difficulties involving coordination and strength and mobility, can be a factor. People with a traumatic brain injury might experience various motor disorders, which can manifest themselves in ways affecting different aspects of movement control. Some people might struggle with fine motor skills, such as precise hand movements, and other people might experience challenges with gross motor skills, such as problems walking or maintaining balance. Those motor disorders can significantly impact someone's ability to perform daily activities and might require specialized interventions and therapies to improve motor function and improve overall quality of life. And then there's some sensory problems. Another secondary effect, side effect, and complication that can arise after a TBI is sensory problems. We kind of mentioned a bit about this earlier. The sensory problems can manifest in various ways, and affecting different senses, even such as vision, hearing, or tactile sensations. It's important to note that these issues can vary vastly from one person to the next, along with the severity of those symptoms, and depending on the severity of the brain injury and the specific area of the brain that was affected, can all play factors in that. Visual disturbances, for example, might range from blurred vision, and I get that, and never realized that could be an effect. But they can range from blurred vision to difficulty focusing, or even complete loss of vision in some cases. Similarly, people with a TBI might experience changes in hearing, such as a sensitivity to loud noises or difficulty understanding speech. And then the tactile sensations can also be affected, leading to changes in how somebody perceives touch or temperature. Those sensory problems can have a profound impact on someone's daily life, making it challenging to perform everyday tasks and engage in social interaction. So it's very crucial that people with a traumatic brain injury receive proper assessment and treatment, and beware of potential complications later on. Just want to give a disclaimer. Remember, take note, this is just for information. It's not a substitute for medical advice. Always consult a healthcare professional for specific concerns, not just for me, anyone that you hear online or on a website. Always go to someone with a medical degree for your advice. Consult your healthcare professional. Final thoughts, understanding secondary TBI and its long-term side effects and implications it's crucial, especially for people who believe that the journey ends after they've initially recovered from the initial trauma. So that ends today's message, and I hope that you found it informative. Join me again tomorrow, and we'll continue learning a bit about TBI. I'll try not to go into the weeds and the intricacies as much. Maybe we'll answer some questions that people have about traumatic brain injury tomorrow. So I hope you enjoyed it. Glad that you're here. Glad you stopped by. It's not easy creating when you've got health things going on. What am I thankful for today? Today I'm thankful and I'm very grateful for my oldest daughter, Natalie. Even though she might be in England, half a world away, she means the whole world to me. We talk every day, and I'm truly grateful to have her in my life. She inspires me, encourages me, and even loves me. So you can't get better than that, can you? And so thank you for tuning in, and love you all. Come back tomorrow and check out another episode. What are you grateful for today? Let me know in the comments. Thank you again, and I love you. Goodbye for now.